We're now going to move on to the second session of the day. And when I opened the conference earlier, I alluded to the pace of change that we've seen this year. I've been fond of saying that that the pace of change is faster than it's ever been, and it will never be this slow again. I sort of hope that I'm wrong about the second part, but in any case, we are clearly dealing with complex, radical, fast-moving change, whether it's COVID, whether it's racial and social justice, whether it's the whole political polarization that's going on in the world right now. And those are just a few of the topics that Edelman's global president and COO, Matt Harrington, is going to address in our next session. He's going to be introducing you to a couple of great speakers as well in Franz Paschke and Kim White. In order to do that, I'd like to hand over now to Matt Harrington. Welcome, Matt.
Great. Hello, everyone. Good afternoon, Paul, and folks in Europe. Good morning to everyone on the East Coast. It's great to be together. I am looking forward to the conversation that we're going to have with a couple of experts in our field and industry leaders, but I thought I'd spend the first few minutes providing some context and setting really the stage, if you will, for our conversation. When you think about these past 7-8 months, there's not a corner of our lives that hasn't been touched due to a confluence of crises. It's first led off by the global pandemic, but then a deep economic recession that's been felt world over, calls for racial justice starting in the US, but playing also outside of the US, political polarization, and a worsening climate situation are just a few of the things that have made up 2020. And what I'd like to speak about is how these conditions are reshaping expectations for business and certainly reshaping the mindset of the consumer and impact our mandate as leaders and marketers and communicators. The major point that I want to underscore is that we all have to help fill a very large void at this moment, which is the lack of factual information. And as communicators, we have the ability to champion trust, foster dialogue, and better collaborate in order to enable the kind of environment where we can thrive in the future. Next slide. So on to trust. Many of you are familiar with Edelman's Trust Barometer, which has been, was initiated 20 years ago, and it was prompted because of the Battle of Seattle in 1999, when the WTO had its first meeting there, and there was this really explosion in the streets, if you will, protesting the establishment, the few having sort of deciding the fate of the many. And interestingly, that event was a central force that shaped the rise of trust in NGOs, which was one of the earliest findings and a key theme in our first study. Next slide. In the intervening years, however, major technological change has reshaped the Global Trust Barometer's findings, specifically who we trust and sources of influence. For example, a rise of a person like me that we really saw with Facebook's arrival prompted then a person like me to be a trusted, influential spokesperson and was driven all the more by social media democratizing information, sharing and enabling peer-to-peer influence. And then more recently, social media has fueled concerns about echo chambers and concerns about governance of accurate information, and more on that in just a moment. Next slide. While we've seen the trust in institutions ebb and flow in the intervening 2 decades, the 2020 Trust Barometer revealed a collapse of trust across all 4 segments that we study: business, government, media, and NGOs. And further complicating this, we discovered a real significant trust divide. The informed public, those college-educated, high household income, active in business and society, have greater trust in institutions and believe they're working better for them than the mass population. So that it's no wonder that the overarching theme of our 2020 report related to the need for competence and ethics. Next slide. As I've been considering trust over these last months, and particularly because of our current operating environment, I keep coming back to the angst of social media. And that's the core tenet of the social dilemma, which started streaming on Netflix last month and in a short time has already been watched by millions. Early employees of some of the largest tech platforms look back with some regret at the negative sides of social media. A finer point that I'm intrigued by as well is the sense of context collapse, which is a phrase that the technology and social media scholar Dana Boyd helped conceive to describe the tendency of social media networks to flatten our lives. It's the moment when one realizes that talking to everyone is the same as talking to no one. I think of context collapse to a degree helping frame the challenges we're all experiencing today in relaying and receiving information. Next slide. So to that end, in 2020, it seems we have to continually ask ourselves, who do we trust? What truth is it? And what truth are you looking for? Or worse, what truth do you want to hear? Next slide. I think the complexities around where and how to find accurate information have been painfully on display during the pandemic, where the simple act and rationale of wearing a mask has been undermined and politicized. During one 2-hour period a few weeks back, the CDC was communicating one set of facts, and shortly thereafter, the administration contradicted the science. We conducted several pulse surveys over the course of the last several months to understand how trust has been impacted by COVID-19. And what has been showcased is a real infodemic, where there's a plethora of information, but little of it is credible. And while most people are getting their information on the coronavirus from major news organizations, a third of respondents said they have to hear, read, or see something in mainstream media 3 to 5 times or more in order to believe it. And meanwhile, 3/4 say that they believe their doctors or healthcare providers, followed by national health authorities, but only 21% are getting most of their information from MDs. There's this fundamental mismatch of where we are getting our information and our belief in that information. So what does that mean for us as communicators? Well, next slide. We have a responsibility to rally against disinformation. A 2018 study by MIT's Media Lab revealed an alarming finding. False information spread on Twitter faster than the truth, with the top 1% of false news cascading between 1,000 and 100,000 people, whereas the truth rarely diffused to more than 1,000 people. So it's no wonder that more than 3/4 of the population is worried about fake news being used as a weapon. It's an extremely confusing and complicated environment. And in a year like 2020, there's more urgency than ever for us as communicators to take action. Next slide. So in this environment, the importance of what we do has never been greater. As a result, I believe there's a new and powerful mandate for communicators. We need to be truth tellers, conduits to factual information, and guardians of stakeholder trust. As communicators, there can't be variations of the truth. We must integrate and be respectful of science and data, ensuring that we're helping others, from our clients to employees to the media, so that they have access to and operate with the facts, enabling them to make informed decisions. Next slide. I believe this mandate comes to life through 5 key actions, and these are the territories for the conversation that we're about to have. The first is to act with compassion. A second, help solve today's macro challenges, be a problem solver. Third, take action to address social and racial justice. Racial injustice. It's not just words, it's action. Fourth, understanding the implications of our news and information economy. And then fifth, mitigate unintended outcomes of accelerated digital transformation. So I keep these 5, I think, in mind as we go through the discussion, and I'd now like to welcome to the session 2 friends and leaders, as I said at the top. So we're joined this morning by Franz Pasha. Welcome, Franz.
Hey,
Franz leads PayPal's global external and internal communications functions. He's the SVP of Corporate Affairs for PayPal. Also oversees the company's global government relations and public policy activities, and responsible for social innovation efforts that drive positive social impact. And we'll get into discussion of that in a moment. And also joined by Kim White, the Chief Communications Officer for CVS Health, a very important place in all of our lives these days. Kim became CCO at CVS Health in April of 2020, overseeing corporate communications and reputation, media relations, social and digital communications, employee engagement, crisis and issues management, and executive visibility. Welcome, Kim. Is Kim there?
Yes. Can you hear me now?
Great. Yes, fantastic.
Someone has to start every presentation with that, right?
It's 2020. It's the way it rolls. So I appreciate I ran through my sort of opening rather quickly, but there is between the roles that CVS and PayPal are playing in society at the moment, I think lend themselves to sort of the 5 tenets that I just offered up. And I thought I'd love to hear from both of you, the first about solving problems and the role that communications has been playing at your companies over the last months. I think you both have been solving problems well before the pandemic. But maybe Franz, if we could talk about how increased focus on financial vulnerability and the growing wealth gap, which plays into, I think, this information and trust gap that I talked about. How is that playing out at PayPal in terms of the ways in which you think about social impact?
Sure. First, let me thank Provoke Media for hosting us today. And I also want to call out the leadership that you've taken, Matt and Edelman, and really putting trust on the agenda and the leadership during this pandemic. I think it has given more visibility to the work that all of us do and raised our game. It's been a big contribution to our profession. So thanks for that. And Kim, I mean, CVS in our communities, the work you're doing right now during the pandemic is extraordinary. So let me go to the question. When you think about problem solving, the work we do, it's an hour by hour, day by day, quarter by quarter exercise. But if we put it in the context perhaps of the pandemic, maybe I can share some thoughts. So the way in which our corporate affairs team sort of was brought in to the thinking around how PayPal would respond to the pandemic was really across all of our stakeholder dimensions. And we take what I would call a stakeholder capitalism approach to how we think about our stakeholders when we're faced with a big issue or problem. So our team, which spans across those, we came in very early. I think we started meeting and putting together our steering committee on addressing the pandemic at the end of January. And we're really in high gear by the time things really started to close down globally in early March. Because we're a global company, we were addressing the issues in Asia first before really, and then Europe, and then the US. But we looked first at our most important stakeholder, our employees. And we focused on how we could both make sure we could preserve the health and safety of all of our employees, but also serve our customers by managing the transition to work from home in a way that we could still provide the kind of 24 hour by 7 days a week coverage that PayPal needs to provide. And we knew our customers were going to need us in very specific ways as they started to transition to shopping from home, supplying their homes from home, and also how companies were transitioning. Small businesses needed to be able to get e-commerce up and going. Our business customers had to manage for a whole new level of online shopping, and the necessities of the pandemic affected all parts of our business. So we looked first at customers because we knew to serve our other employees. To serve all of our stakeholders, our employees had to be in position. We also wanted to do this in a democratic way, that we could move to working from home in a way that respected all of our employees, and that we wouldn't have, some kind of, separation between the people who had different levels of roles at the company. And that was very important to us, to focus on that fairness. And that goes to our approach to financial health and how We wanted to be sure everybody was well situated. I don't want to go too far on this question, but we of course then looked at our other stakeholders, our customers, our regulators and governments, and of course all the nonprofits that we serve through our donation platform, and how we could help to support the relief efforts.
So I think we'll come back to some of those stakeholders in a moment. Kim, I want to bring you in because CVS has been repositioning itself very much as a health company. And a large part of our familiarity is because you're also brick and mortar and essential workers. So you had a lot of complexity in terms of how to probably navigate keeping your employees safe, customers safe, and can you share a little bit about what those early days were like for you?
Sure. That's absolutely right. I feel lucky that I actually joined the company about 90 days in, when a lot of the planning that Franz is speaking to, had already been well underway. And so I came into a pretty well-oiled machine from my dining room table at the end of April. But what I would tell you about COVID and what it's done for our business ultimately is it's really been, surprisingly, and nothing that any of us were hoping for or expected, but a great accelerator to our strategy. Because Matt, as you just mentioned, CVS Health is so much more than just your corner drugstore. That's what we're known for. 3/4 of all Americans live within 3 miles of a CVS. We have more than 10,000 retail touch points. And yet CVS Health itself is a Fortune 5 corporation with more than 250 billion in revenue. And we actually have 3 major business units: Aetna, the insurer; Caremark, the pharmacy benefits management company; and then CVS Retail, which is the way that we're best known, to most consumers.
Right.
But all of that, collectively, these companies are under one roof, really looking to transform the way that healthcare is delivered and to make it more local, to make it more accessible. So we have lots of initiatives underway to do that. And what COVID sort of forced us into very quickly was testing. And that was not a place that we were necessarily looking to go the year prior. And it started with a parking lot in Shrewsbury, Massachusetts. And now it's expanded to the company offering COVID testing in nearly 4,000 locations across the country. So it's been a real accelerator. We never could have imagined this is where we're going. But I think testing is going to take us squarely into vaccinations next year.
Which I noticed your announcement yesterday about seeking 15,000 more employees to navigate flu season and vaccines.
That's right. There are some bright spots on the employment front in this. It's a good time to be a pharmacist or a pharmacy technician, certainly. But we are gearing up to make sure that we're ready to be on the front lines of vaccinations. We won't be the only ones, but again, given that retail footprint, that community footprint, we do expect to be front and center there. And so we feel like we've got an important role to play and we're very, very grateful that Americans put so much trust in their pharmacists, because they're a very trusted profession. That's been the case year after year after year, via Gallup polling and the rest. But in terms of trust and who we turn to and who we believe, we recognize that we have a great responsibility, because we are on the front lines, really talking to people, delivering those tests, hopefully delivering vaccines, and being a trusted and reliable source in a face-to-face setting.
Which, you mentioned the point about the acceleration of innovation that you've navigated at CVS. Franz, that's, I think, a cornerstone aspect of PayPal. The two of you actually partnered on an innovation in the midst of all of this. Yeah. But how has innovation accelerated at PayPal over the last while?
Yeah, I mean, we've had a surge in the use of our products and services that has really focused our energies on how do we serve customers in this environment, how do we meet that need. And we saw an acceleration, in the last 6 months that we could have expected would have taken place over many years. To address that, we also understood people needed and wanted to be able to shop without touch, without risk. So we focused on QR codes and on really focusing on touchless payments. We focused on how we could serve small businesses in different ways. We also looked at different ways of providing relief to our customers to get them through that first stage of the pandemic. And we put a lot of focus on how do we manage for all the additional transactions that are taking place online. Some of those innovations are visible to customers in the way in which they interact with our services. Some of them are internal in the way we raise our capacity and organize our workforce to be able to meet all the demand. And some of them are the way in which we've been thinking about social impact and how we are working to support both relief organizations that first saw a real decline in giving and then saw a huge upsurge that needed support. And also small businesses have had a whole range of needs, and we've seen an undue impact on Black and minority-owned small businesses. And we've really focused on how we can step up to help those most vulnerable businesses and communities.
But you both have mentioned sort of the intensity of the amount of work that you've needed to do, the amount of innovation. From a communications perspective, how are your tone of communication, particularly if you're thinking of your employee populations, changed? I mean, we talk about the need for empathy, but how are you via communications helping people navigate this time and frankly just cope?
Yeah.
I'll go with either of you.
Oh, go ahead.
Well, I think, I was just going to say, I think that we are going, just as we are in the world of media relations, I think we're going hyper local. And I think that it's probably never been so important to have, strong touch points with your primary manager, with your direct supervisor, with your team. That's not to say that all sorts of leadership communications, and we're using every channel you can imagine, aren't important. But I think at the end of the day, as we're trying to stay connected, I think that kind of the local and the home-based nature of the teams that we're all a part of has been especially important. And I think that we've taken a lot of common sense steps to try to encourage empathy and, understanding of the idea that everyone's working, in a slightly different environment. Therefore, you can hear the noise I've got going on in the other room here too. So everyone's trying to do the best they can.
Yeah.
Yeah, I guess, Matt, we've approached on several levels. I think the first thing that we really had to address was how to get sufficient information to everybody about health and safety. And as people move to working from home, and in tens of thousands of employees around the world moving to working from home, there was a need to make sure everybody had access to information and understood what that would mean for the way they work, the benefits they receive, how they would manage across their teams, and what would be the expectations of flexible time, and how to manage for all the stresses that people are facing from working from home. So one of the ways we went at this was to set up immediately a portal that we called Stay Informed, but where all questions could be answered. We would post all of our policies, all of our announcements, and sort of be able to move everyone towards a single source of truth where people could really get that information. And then we relied heavily on our CEO, who is a very effective communicator and initially was really guiding the company, and still does, but we've sort of been able to, understand the cadence of those communications. We've had a lot of communications from our HR team around changing benefits, and there are a lot of complicated issues that people have had to face. We've put in place special provisions for crisis leave so that people who needed to sort of stabilize their families or spend time with relatives or just figure out their home environment in different ways. We've got extra and additional sort of mental health benefits to help people who may be struggling. We've got flexible time arranged, and we've really asked and tried to equip all of our leaders with the kind of training and sort of communications toolkits that they need to be able to translate, the company's, care and concern for what their teams need to do. And we've also, as we've gone through some very difficult times, particularly in the US, but also in other companies around social justice and around racial inequity, we've created opportunities for what I would call safe place discussions, for being able to have the kind of conversations that can be difficult to have across different political views and different positions in the world. How do you have those conversations within a company in a way that brings you to a constructive community building outcome? So we focused on that as well.
Yeah, Franz, if I just wanted to build one point on that. Yeah, I was thinking about, a number of things that you both just said in terms of changing consumer behavior, and then thinking about our own employees and how we get them to take care of themselves as well. Our employees, of course, are one big group of consumers. And what we're seeing in the outside world and talking about in the outside world, we have to address in the inside world too. So from a healthcare perspective, I mean, anyone in the business of telemedicine could never, have imagined, sort of the accelerant that the pandemic has been to get people to consider sort of seeing a doctor, having a medical appointment via video. And of course, that has just grown exponentially. And so when I think about our own employee population, we have encouraged that just as we have with the outside world. And we've had the same worries about our employee population that we have had about the outside world. For example, with people delaying medical treatment, with people delaying testing, people being afraid to go to a doctor's office, to get their mammogram, to go for normal screenings and things like that. Because that delay in medical care, we worry will really push some big problems further down the line, when in fact there'll be bigger problems, if they're not tended to earlier. And so we've had to think about that with our own workforce, just as we're thinking about the outside world and the kinds of behaviors that we're looking to encourage.
And so does that mean that you're, with your own employees, giving them, as Franz talked about, the time to get their checkups, to do the sort of vaccines that they should be doing with children on a regular basis?
Sure. But in addition to time, it's really more the encouragement and sort of the safety and security in knowing that measures are being taken and that this is a safe way to proceed. And we need to give them the encouragement, just as we do, any, say, Aetna member, that it's important to seek care and not to delay these things.
Franz, you mentioned, PayPal's efforts to meet the moment of the racial injustice conversation that's been important and being held in the country in the last many months. I think what has been good to see is the recognition that it is not just a moment, but that it requires sustained discussion, sustained conversation. You talked about creating these safe places for conversation. How are you fostering the continuation of the dialogue?
Yeah. No, I think that's right. I think we've been saying it's not a moment, it's a movement. And someone other than me said that first, I'm sure, many times. When we stepped into this, we've been thinking about these issues for a long time. So we've, through the lens of how PayPal interacts in communities, very often it's through our partnerships with nonprofits, but also through the work we do to support small businesses all over the country, and in particular work to support minority-owned and Black-owned small businesses. So after George Floyd, when there was really, it became so clear that the pandemic was having such a disproportionate effect on Black-owned businesses and on Black communities, we looked hard at what we could do as PayPal to really get at this and do our part. And of course, one company can only do so much, but there are core capabilities we have, and we're in a fortunate position where we could help. So we put together a program that had sort of 4 dimensions, but one was immediate grants to small Black-owned businesses, and we worked with a great nonprofit in Washington, AEO, to make sure that those small loans got to Black-owned businesses on Main Street all around the country. We also invested in our nonprofit relationships in Black communities, especially nonprofits that were in the business and had deep expertise in supporting and sustaining Black-owned businesses. We put together a $500 million opportunity fund to focus on venture funding of Black-owned venture funders, and also to put our money to work in community banks. And we invested, and this is the part I think that comes around to the premise of your question, we also took $15 million of that 530 and put it into the company's programs internally to engage our employees in focusing on inclusion and diversity, to support our employee resource groups who really were eager to engage, and we needed it to be organic. And in all of these initiatives, we have an army of employee volunteers who are both already skilled and trained to mentor and support small businesses, or who are doing training, or who are coming forward to help us on every dimension. So it's been an all-in company effort. We communicate about it. We involve our employee resource groups, and we have more volunteers than we can handle to work on these projects.
A great problem to have, and you know, clearly all that work is fostering connectivity too within the enterprise, which is great.
I think that's right.
Kim, how is CVS Health thinking about the sort of the taking a long-term approach?
Sure. Well, Franz, I think the work at PayPal is so impressive. You know, we've undertaken many similar kinds of initiatives really through the lens of health. And so, you know, one thing that you hear about when you work in healthcare is this idea that your zip code determines your health almost more than anything else, literally where you were born. And so we talk about social determinants of health. And so CVS Health has got a large foundation, and we've been very active in grant giving and in working with organizations and communities across the country to use our local footprint for good, to use our force and our size for good, but really to help with those things that determine health from the very beginning of your life. And in fact, a lot of our funding goes toward affordable housing, which I think is really interesting in terms of just getting people off, you know, on a safe start to live in a safe and healthy place, to make sure that your environment actually doesn't make you sick. But from a communication standpoint, you know, I tell you the interesting thing for us and what was a challenge is that despite the fact that, you know, a lot of this good work had been underway and we knew we needed to refresh these commitments and make sure that, you know, they were the right thing for the time and to go the distance, as Francis talked about. This isn't just a, you know, a moment for any of us. I think we chose to take a step back at a moment in time when a lot of big corporations were rightfully stepping forward and writing a check and giving donations and really kind of putting themselves out there. And we took a little bit more of a conservative approach. My CEO felt like, let's step back. We're already doing a lot of good things, but let's figure out whether or not those good things are the right things, whether they're paying dividends, whether money can be used more wisely in other ways. And we took, you know, sort of a very thoughtful analysis and had this drive into, you know, our social justice commitments. And it took us a good 45 days to do it. And I tell you this because 45 days can feel like forever in the world of communications when on a daily basis, you know, all of the news coverage is flying around about the next great company that has launched another great initiative. And, you know, the worry for us was we're taking too long. You know, we're going to be behind in this. And we were in some respects, because it did take us a little while to be ready to step forward and to speak to our commitments and what was going to be new. And our commitments are significant. You know, we're dedicating more than 600 million over the next 5 years. And yet I would tell you that by the time we were ready to go public with that, the news cycle had moved on. And the truth is, you know, we honestly didn't really care all that much because it wasn't about getting publicity. It was about doing the right thing. But it was a very delicate balancing act to want to be responsive and yet to want to be thoughtful. And I know that our own employees, you know, in those early days were feeling like, when will we be ready? What are we going to do in addition to the good work we've already done? And we had to kind of balance the short term with the long term.
Yeah, but I think, you know, taking that moment and having the discipline to do it and not run into the fray, I think is to be commended, because when you have the moment to tell your story, your employees will be more receptive, I think, to hearing something that has really reflected of thought and consideration and the company's values. We've got a
Matt,
question.
I'd also just like to add, I think it's what Kim's describing is also a great example of how important it is for important companies to draw deep inside and figure out what are the core capabilities that we can give that no one else can give, or that we can lead on. And that's in a sense a responsibility and an obligation. And if all companies did that, and I'll sort of speak to everyone out there, if all companies did that, we'd really be able to, you know, play a leading role as the corporate community in addressing these problems by putting to work not just our cash, but our core capabilities, our insight, our research, our knowledge and technology, and the expertise of our employees. And that's a great way to advance social impact.
Yeah, completely agree. It's assessing your own assets and how they can be deployed to address social issues and social needs.
That's right.
We have a question that's come in that's just an interesting sort of continuation of this particular piece of our conversation, which is, a curiosity about what efforts might have been taking place by either of your companies to support Chinatown businesses across the US when the pandemic first appeared and did affect, I know that was the case in New York's Chinatown, affect Asia-owned businesses where they saw a dramatic decrease in traffic. Was there anything in either of your companies did in particular to address that community?
You know, in our case, I think we were focused on all minority-owned businesses and small businesses in the first wave of the pandemic. And so we were addressing that, but in the context of our overall platform on supporting minority-owned small businesses.
Great.
That was the approach we took
Kim?
at the outset.
Yeah, I mean, same larger theme of thinking about all of the communities that we consider, you know, within our D&I efforts. And that's something we've had to be really careful about because, you know, I think everyone has seen and, you know, read about the conversations about Black Lives Matter versus All Lives Matter and understood kind of, you know, as you unpeel that back, you know, how that makes people feel when we say these different kinds of things. But we have definitely had discussions within the walls of CVS Health of making sure that, you know, we are disproportionately focused, I think, right now on the needs of the Black community because that is where the house is on fire. But having said that, that is not at the expense of other communities that we care about, you know, whether they're colleague groups, customers, or just, you know, the outside world that we live in service of.
Right, and driving inclusivity overall. I mentioned in my opening remarks, and we only have a few minutes left here, infodemic. And the challenge, I think, with all of us receiving sort of 5,000 messages a day, if probably more than that, as communicators, how are each of you thinking about channel strategy for your message to get through? And or Kim, I would think in your world, you're needing to ensure that people understand and respect the science and the facts of the pandemic. Are there particular efforts you're making to address your stakeholders in the battle against misinformation?
Sure. I mean, I tell you two things, which, you know, funny enough, are going to make it sound like it's 1978, because I think that what we're going back to and really finding is working for us is hyper local media relations. Really, you know, at sort of the city and community level. If you think about how we've been rolling out testing, for example, I mean, we must be, gosh, into wave 15 of local publicity. The New York Times cares about testing, you know, at a high level and what's going on across the nation. They don't care about whether or not you can get your test now at the store on Main Street in Kankakee, Illinois. But boy, the people of Kankakee do. So we have gone hyper local on the media relations front. And, you know, there's another element to this as well, back to that trusted pharmacist, which is we are face to face. And Amazon has proven, you know, amazing resilience, and they have done amazing things in the course of the pandemic. And I don't know, you know, a person who hasn't come to rely on them. And yet at the same time, Amazon is not going to be able to deliver your vaccine, and Amazon is not going to be able to talk to you face to face about the, you know, the timeline associated with your test or the side effects associated with the vaccine. And so, you know, we feel a real responsibility to arm our colleagues who are, you know, really customer facing with the right information to do their jobs.
And make certain everybody gets their flu shot.
Absolutely. Right? We are running way ahead. So actually, so far, I think everyone's getting that message.
So a closing question, I think, for you both is future facing and really what lies ahead in the weeks to come, particularly in the US. How are you thinking about communication internally, externally, approaching November 3rd and election day and the day and weeks to follow? Don?
Yeah. I mean, you packed a lot into that closing question, but let me see. I'll try.
We had 5 minutes.
I can do it. I'll try to unpack it. All right. I would say that, you know, we are very mindful that over time, working from home, that there's accumulated stress. We've been looking at global wellness days that we've introduced and announced in advance. We're looking at the kind of pressures that parents in particular are facing and how we can be as supportive as possible. There are lots of policy issues around people and the, you know, where they're living, where they're working, how we support them, and developing new ways to communicate, new technology internally that will enable us to continue to enrich the working from home experience, whether it's around talent development, leadership development, how we evaluate. All of those things require a real consciousness, and we're put ourselves against that. In terms of the kind of ups and downs in our in our sort of what I would say society and economy, like elections. We are also doing a lot of scenario planning and thinking through, looking at all the what ifs and how we can, again, support our employees and make sure that we have safe spaces for hard discussions, that we're able to support communities that may feel more vulnerable, whether it's in the US or around the world, depending on what is going on in society. And with our customers, we know we have to have really clear information. People need our services. As with CVS, clarity is so important, and access to that information. So we've been focusing on that as well, because there's an impatience that builds for people who are living their lives online at home, and you've got to really be responsive because people are stressed.
Well, and PayPal's been a big initiator of the Get Out the Vote effort, right?
Yes, and that's right. And we are trying to mobilize as many companies as we can to provide time to vote and flexible hours and other ways to enable employees to vote on election day. And that's been a huge effort within PayPal. Lots of our employees are involved in this. It's nonpartisan. It's focusing on, inclusion and participation in our democracy. And we've have over 1,500 companies signed up to provide support for their employees to vote. And that's been a hugely powerful communications program as well.
And Kim, how are you thinking of communications over these next several weeks?
Very, very carefully, building on what Franz was saying, we too have had, communications initiatives about the importance of voting in a nonpartisan kind of way. And we've built on that by really trying to, remind our employees that we don't expect that we're going to wake up on November 4th and know who our next president is. And that we've really got to have trust in the process and trust in institutions and trust that every vote will be counted. As it relates to, who ultimately wins and what that communication looks like, we have 300,000 employees, of all stripes, of all shapes and sizes. And the same really goes to our customer base. All sorts of people, shop at CVS, may have their healthcare coverage through Aetna and the rest. And so we recognize that it's going to be a really delicate balancing act, because regardless of your politics, there's going to be a big chunk of customers or employees who are happy and a big chunk who are unhappy with whatever that outcome is. And so, my hope for all of us really is that whatever the outcome is, feels and is credible and legitimate, and that hopefully we can all get behind. Well, I'll stop there. I'm about to go a moment too far. I think for a better 21.
Yeah, well, we're all hoping for a better 21.
Yeah.
It can't come soon enough for my purposes. And I just want to thank you, Kim and Franz, for joining me in this conversation, but also for the tremendous work you both do and your companies do to foster trust in the marketplace. So thank you. And with that, Paul, back to you.
Thank you, Matt. Thanks for raising so many of the critical issues that I think are defining what our profession is about in 2020 and beyond, hopefully as we move into a post-crisis era. And thank you very much to Franz and Kim, not just for participating in this event, for which we are grateful, but also for bringing to us examples of two companies that have become absolutely vital to people's lives, or even more vital to people's lives over the last 12 months, and that are taking their leadership responsibility and their responsibility to act and communicate in a responsible, ethical manner so seriously.